Question 1. What is the main purpose of a functional behavior assessment, FBA? A. To teach the client new skills. B. To identify the function or purpose of a challenging behavior. C. To eliminate all challenging behaviors immediately. D. To find out what items the client likes. Answer. B. To identify the function or purpose of a challenging behavior. This question asks about the primary goal of a functional behavior assessment, FBA. An FBA is a process that your supervisor uses to figure out why a challenging behavior is happening. People engage in behaviors, even challenging ones, because those behaviors work for them in some way. They serve a function, like getting attention, escaping a task, getting a toy, or feeling good internally. Understanding this function is crucial for creating an effective plan to replace the challenging behavior with a more appropriate one. It's not about teaching skills, A. Immediately stopping behavior, C. Or finding preferences, D. It's all about figuring out the why behind the behavior. Question 2. If a client bites their hand and you immediately give them attention by saying, "Please don't bite," and the hand biting behavior increases in the future, what is the likely function of the hand biting? A. Escape. B. Access to tangibles. C. Automatic. D. Attention. Answer. D. Attention. This question is asking you to identify the function of a behavior based on what happened immediately after it and how it affected the behavior in the future. The behavior is hand biting. The consequence is you providing attention. Please don't bite. The result is that the hand biting increases. When a behavior increases because it is followed by attention from another person, the function is attention. Escape is getting away from something. Access to tangibles is getting a toy or item. Automatic reinforcement is from within the person. Since your attention made the behavior happen more often, attention is the likely function. The behavior works to get them noticed. Question 3. In the ABC model, what does the letter A stand for? A. Action. B. Effect. C. Antecedent. D. Avoidance. Answer. C. Antecedent. This question tests your understanding of the fundamental ABC framework used to analyze behavior. The ABC model helps us understand why behavior occurs by looking at the events that happen around it. The A stands for antecedent, which is anything that happens immediately before the behavior. The B is the behavior itself, what the person does or says, and the C is the consequence, what happens immediately after. The antecedent is the trigger or the cue that sets the stage for the behavior. Remember, the antecedent comes first, before the behavior. Question 4. What is the main difference between positive reinforcement and negative reinforcement? A. Positive reinforcement increases behavior, while negative reinforcement decreases behavior. B. Positive reinforcement adds a stimulus to increase behavior, while negative reinforcement removes a stimulus to increase behavior. C. Positive reinforcement involves giving tangible items, while negative reinforcement involves giving praise. D. Positive reinforcement is used for teaching new skills, while negative reinforcement is used for reducing challenging behavior. Answer. B. Positive reinforcement adds a stimulus to increase behavior, while negative reinforcement removes a stimulus to increase behavior. This question asks you to distinguish between the two types of reinforcement. Both positive and negative reinforcement increase the future likelihood of a behavior occurring. The difference lies in how the consequence is delivered. Positive reinforcement involves adding a desirable stimulus, like a treat or praise, after the behavior. Negative reinforcement involves removing an unpleasant or aversive stimulus, like a demand or loud noise, after the behavior. Option I is incorrect as both increase behavior. Options C and D describe types or uses of reinforcement, but not the core defining difference. Reinforcement is about increasing behavior. Positive means adding, negative means removing something unpleasant. Question 5. When collecting data, what does frequency measure? A. How long a behavior lasts. B. How many times a behavior occurs. C. The time between a cue and the start of a behavior. D. Whether a behavior occurred within a time interval. Answer. B. How many times a behavior occurs. This question asks about a common measurement method in ABA. Frequency, also known as count, is simply a tally of how many times a specific behavior happens during an observation period. Duration measures how long it lasts. Latency measures the time from a cue to the start of the behavior. Interval recording methods check if the behavior happens within or at the end of a specific time period, not necessarily counting every single instance. If you're just counting how many times, you're using frequency. Just make a tick mark every time you see it. Question 6. What is the ethical responsibility of an RBT regarding client confidentiality? A. To share client information with anyone on the treatment team, including teachers and doctors, without needing specific permission. B. To keep all client information completely private, even from their supervising BCBA. C. To discuss client information only with authorized individuals directly involved in the case and in appropriate settings. D. To share general information about client progress with family friends to celebrate successes. Answer. C. To discuss client information only with authorized individuals directly involved in the case and in appropriate settings. This question is about a critical ethical responsibility. Protecting client privacy. Confidentiality means keeping sensitive client information private. You should only discuss client information with people who are authorized members of the client's treatment team, like your supervising BCBA or other RBTs assigned to the case, and who have a professional need to know. These discussions must take place in a private setting where you cannot be overheard or where records cannot be seen. Sharing with unauthorized individuals, D, or keeping information from your supervisor, B, violates confidentiality. Client privacy is paramount. Share only with the necessary team, privately. Question 7. If a behavior is followed by a consequence that makes it less likely to occur in the future, this is called A. Reinforcement. B. Extinction. C. Prompting. D. Punishment. Answer. D. Punishment. This question asks about a principle that decreases behavior. The key phrase is makes it less likely to occur in the future. Any consequence that immediately follows a behavior and causes that behavior to decrease in frequency in the future is defined as punishment. Reinforcement increases behavior. Extinction is withholding reinforcement to decrease a behavior that was previously reinforced. Prompting happens before the behavior. Punishment weakens the behavior. Question 8. What is the primary role of an RBT during the implementation of a behavior reduction plan? A. To determine the function of the challenging behavior. B. To modify the plan based on client response. C. To implement the procedures outlined in the behavior intervention plan, BAP, as trained by the supervisor. D. To decide when punishment procedures are necessary. Answer. C. To implement the procedures outlined in the behavior intervention plan, BAP, as trained by the supervisor. This question reinforces the RBT's core responsibility in carrying out treatment plans. When a behavior reduction plan, BAP, exists for a challenging behavior, the RBT's job is to follow the specific strategies and procedures written in that plan exactly as they were trained by their supervisor. RBTs do not determine the behavior's function. A. Modify the plan. B. Or make decisions about using punishment. D. On their own. Your role is to faithfully implement the plan designed by your supervisor. The BIP is your guide for helping reduce challenging behaviors. Question 9. When teaching a new skill, what is the purpose of a prompt? A. To decrease the likelihood of the correct response. B. To provide the client with reinforcement. C. To increase the likelihood of the client providing the correct response. D. To test if the client knows the skill. Answer. C. to increase the likelihood of the client providing the correct response. This question asks about why we use prompts in teaching. A prompt is extra help or a cue given before the client responds. The purpose of a prompt is to make it more likely that the client will perform the desired behavior correctly, which then allows you to reinforce them. This helps the client learn the skill efficiently. Prompts aren't meant to decrease responses. A, they aren't reinforcement. B, and they are used during teaching, not just for testing. D, prompts are there to help the client get it right so they can earn the reward. Question 10. Which type of data collection measures how long a behavior lasts from beginning to end? A, frequency. B, duration. C, latency. D, momentary time sampling. Answer: B, duration. This question asks about measuring the length of a behavior. Duration recording involves timing how long a specific behavior occurs, from the moment it starts until the moment it stops. Frequency counts occurrences. Latency measures the time between a cue and the start of a behavior. Momentary time sampling is checking if the behavior is happening at specific moments. If you need to know how long something continues, measure its duration. Question 11. If a client is taught to respond to the instruction, touch your nose, by touching their nose, and this behavior reliably occurs only when that specific instruction is given, the behavior is said to be under A, generalization. B, discrimination. C, stimulus control. D, maintenance. Answer: C, stimulus control. This question asks about the relationship between an antecedent stimulus and a behavior when that stimulus reliably cues the behavior. When a behavior happens consistently in the presence of a specific stimulus, the instruction touch your nose, the SD, and not in its absence or in the presence of other stimuli, we say that stimulus has gained stimulus control over the behavior. Generalization is responding similarly to different stimuli/settings. Discrimination is responding differently to different stimuli. Maintenance is performing the skill over time. The instruction is controlling when behavior happens. Question 12. What is the term for gradually reducing the level of prompting provided to a client as they learn a new skill? A, shaping. B, chaining. C, prompt fading. D, generalization. Answer: C, prompt fading. This question asks about the process of reducing assistance. Prompt fading is the systematic process of decreasing the amount of help, prompts, you provide to a client as they become more independent in performing a skill. Shaping reinforces closer approximations to a target behavior. Chaining teaches multi-step tasks. Generalization is performing skills in new settings. Fading is essential so the client doesn't become dependent on your help. Slowly removing the hints is prompt fading. Question 13. If a behavior occurs because it allows the client to escape or avoid a non-preferred task or situation, the function is likely. A, attention. B, access to tangibles. C, automatic. D, escape. Answer: D, escape. This question asks you to identify a function of behavior based on its outcome. The clue is allows the client to escape or avoid a non-preferred task or situation. When a behavior is reinforced because it helps the individual get away from or prevent something they dislike, the function is escape. Attention is getting noticed. Access to tangibles is getting an item. Automatic reinforcement is internal. If the behavior helps them get out of something unpleasant, it's likely escape. Question 14. When you stop providing reinforcement for a behavior that was previously reinforced, and this leads to a decrease in the behavior over time, this procedure is called A, punishment. B, negative reinforcement. C, extinction. D, spontaneous recovery. Answer: C, extinction. This question asks about decreasing behavior by removing its payoff. The key is stop providing reinforcement for a behavior that was previously reinforced, and this leads to a decrease. This is the definition of extinction. Punishment decreases behavior by adding an aversive or removing a desired stimulus. Negative reinforcement increases behavior by removing something unpleasant. Spontaneous recovery is a temporary reemergence of an extinguished behavior. Extinction is letting the behavior die out by removing the consequence that kept it going. Question 15. What is the main ethical responsibility of the RBT regarding maintaining client dignity? A. To ensure the client always complies with instructions. B. To treat the client with respect and ensure their privacy and choices are honored. C. To teach the client complex social skills. D. To avoid all physical contact with the client. Answer: B. To treat the client with respect and ensure their privacy and choices are honored. This question asks about the ethical principle of client dignity. Maintaining client dignity means treating each client with compassion, empathy, and respect. It involves respecting their privacy, related to confidentiality, providing opportunities for choice and self-determination whenever possible, and talking to and about them respectfully. It's about honoring their worth as an individual. It's not about compliance, teaching specific skills, or avoiding all physical contact. Treat them with the respect they deserve. Question 16. You are teaching a client to get dressed using a task analysis. You teach the steps by prompting the client through all steps of the task analysis from start to finish in each teaching trial, and you reinforce them upon successful completion of the entire sequence. What chaining procedure are you using? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Shaping. Answer: C. Total task chaining. This question describes a method for teaching multi-step skills, a task analysis. The key is that you are working on all the steps of the task analysis, guiding the client through the entire sequence from beginning to end in each practice opportunity. This is total task chaining. Forward chaining starts by teaching the first step first. Backward chaining starts by teaching the last step first. Shaping is for teaching a single behavior, not a chain of steps. Total task chaining means attempting all the steps in one go during teaching. Question 17. When collecting data using partial interval recording with 1-minute intervals, you mark yes for an interval if the behavior occurs. A. For the entire 1-minute interval. B. At any point during the 1-minute interval. C. At the very end of the 1-minute interval. D. At least once every 15 seconds. Answer: B. At any point during the 1-minute interval. This question tests your knowledge of partial interval recording, a discontinuous measurement method. In partial interval recording, you divide the observation time into intervals. You mark yes for an interval if the target behavior occurs at all within that interval, even if it's just for a brief moment. Whole interval, A, requires the behavior throughout the interval. Momentary time sampling, C, records if it happens at the very end. Partial interval just needs the behavior to show up sometime in the interval. Question 18. What is the ethical responsibility of an RBT if they observe another RBT on their team engaging in behavior they believe is unethical or harmful to a client? A. Discuss their concerns directly with the RBT involved. B. Ignore it, as it is not their responsibility to report other staff. C. Report their concerns immediately to their supervising BCBA or BCBA. D. Tell the client's parents about the behavior. Answer: C. Report their concerns immediately to their supervising BCBA or BCBA. This question addresses a crucial ethical duty: reporting suspected misconduct. If you observe potentially unethical or harmful behavior by a colleague, you have an ethical obligation to report your concerns to your supervisor immediately. They are responsible for overseeing staff behavior and ensuring ethical practice. Discussing directly with the RBT, A, may not be appropriate or safe. Ignoring it, B, is unethical. Telling the parents, D, could violate confidentiality or cause unnecessary distress. Your supervisor is the required point of contact for reporting concerns about staff. Question 19. What is the purpose of providing reinforcement to a client? A. To reduce the occurrence of a behavior. B. To increase the future probability of a behavior. C. To punish inappropriate behavior. D. To make the client happy. Answer: B. To increase the future probability of a behavior. This question asks about the fundamental purpose of reinforcement. Reinforcement is a consequence that makes a behavior more likely to occur in the future. It's not primarily for decreasing behavior, C, or making someone feel happy. D. Though it can be a positive experience, the core function is to strengthen the behavior it follows. Reinforcement builds behavior. Question 20. What is the ethical guideline regarding accepting gifts from a client's family? A. RBTs should accept any gift offered as a sign of respect. B. RBTs should only accept gifts of significant monetary value. C. RBTs should generally avoid accepting gifts, especially those of value, to maintain professional boundaries and avoid conflicts of interest. D. RBTs should accept gifts but not report them to their supervisor. Answer: C. RBTs should generally avoid accepting gifts, especially those of value, to maintain professional boundaries and avoid conflicts of interest. This question addresses ethical boundaries regarding gifts. Accepting gifts, particularly those of value, from clients or their families can create dual relationships and compromise professional objectivity and boundaries. Ethical guidelines generally require RBTs to decline gifts of value. Although company policy may permit small, inexpensive tokens of appreciation if documented, it's not about accepting any gift, only valuable ones, or not reporting them. Keeping your relationship professional means being cautious about accepting gifts. Question 21. When collecting data, what is the term for the time between the end of one instance of a behavior and the beginning of the next instance of the same behavior? A. Duration. B. Latency. C. Interresponse time, IRT. D. Frequency. Answer: C. Interresponse time, IRT. This question asks about a specific time-based measurement, focusing on the gaps between repetitions of a behavior. Interresponse time, IRT, measures the time that passes from the end of one occurrence of a behavior to the beginning of the next occurrence of the same behavior. Duration measures how long one instance lasts. Latency measures the time from a cue to the start of the behavior. Frequency counts occurrences. IRT measures the time between responses. Question 22. What is the purpose of conducting a skill acquisition assessment? A. To identify the function of challenging behaviors. B. To determine potential reinforcers. C. To evaluate a client's current skills and identify what skills need to be taught. D. To measure the rate of challenging behaviors. Answer: C. To evaluate a client's current skills and identify what skills need to be taught. This question asks about the goal of an assessment focused on abilities. A skill acquisition assessment is used to determine what skills a client has already mastered and what skills they currently lack, which helps the supervisor develop appropriate teaching programs and goals. It's not for identifying challenging behaviors, A. Finding reinforcers, B. Or measuring behavior rates, D. Skill assessments help us understand what the client knows and what they need to learn next. Question 23. When thinning a reinforcement schedule after a skill has been learned, you are changing from reinforcing the behavior. A. Every time to sometimes. B. Sometimes to every time. C. With tangible items to social praise. D. With prompts to independently. Answer: A. Every time to sometimes. This question asks about the process of thinning. Thinning a reinforcement schedule means reducing the frequency of reinforcement. You typically start with continuous reinforcement, reinforcing every time, for initial learning, and then gradually move to an intermittent schedule, reinforcing sometimes to maintain the behavior and make it more resistant to extinction. Option B is the opposite of thinning. Options C and D describe changes in the type of reinforcement or level of prompt, not the schedule. Thinning is about reinforcing less often. Question 24. What is the ethical term for promoting the client's welfare and doing what is best for them? A. Autonomy. B. Justice. C. Beneficence. D. Fidelity. Answer. C. Beneficence. This question asks about an ethical principle focused on the client's well-being. Beneficence means working to promote the client's welfare and benefit, using effective, evidence-based practices to achieve positive outcomes. Autonomy is about choice. Justice is about fairness. Fidelity is trustworthiness. Acting in the client's best interest to do good is beneficence. Question 25. What does the term satiation mean in ABA? A. When a reinforcer becomes less effective because the client has had too much of it. B. When a client becomes agitated or upset. C. When a client is hungry or deprived of a reinforcer. D. When a behavior occurs at a very high rate. Answer. A. When a reinforcer becomes less effective because the client has had too much of it. This question asks about a factor that affects the power of a reinforcer. Satiation occurs when a client has had excessive recent exposure to a particular reinforcer, which temporarily reduces its effectiveness as motivation. For example, if you've given a child access to their favorite toy for an hour straight, they might become satiated on that toy and less likely to work for it immediately after. Deprivation. C. Is the opposite. Satiation happens when they've had plenty of the good stuff. Question 26. When teaching a client to follow a multi-step instruction, each completed step serves as a cue for the next step in the sequence. This is characteristic of A. Discrete trial. B. Stimulus-response chain. C. Prompt hierarchy. D. Fixed interval schedule. Answer. B. Stimulus-response chain. This question asks about the behavioral process underlying multi-step skills. A task analysis breaks a skill into steps. Once learned, performing one step produces a sensory change that acts as a discriminative stimulus, SD, for the next step, and so on. This linked sequence of SDs and responses is called a stimulus-response chain. Discrete trials are teaching units. Prompt hierarchy is about prompt types. Fixed interval is a reinforcement schedule. Multi-step skills become a chain of reactions to internal or environmental cues. Question 27. What is the main purpose of pairing yourself with reinforcement when building rapport with a client? A. To make the client dependent on you for all reinforcement. B. To become a conditioned punisher. C. To establish yourself as a conditioned reinforcer and build a positive association. D. To make the client immediately compliant. Answer. C. To establish yourself as a conditioned reinforcer and build a positive association. This question asks about the goal of pairing. Pairing involves associating yourself with highly preferred items and activities so that your presence and interactions become reinforcing to the client. By being the person who brings fun things, you become a conditioned reinforcer, someone the client enjoys being around and wants to interact with. This builds rapport and makes the client more motivated to learn with you. It's about becoming a source of positive experiences. Question 28. If a client engages in screaming behavior, which is maintained by access to preferred tangible items, which differential reinforcement procedure involves reinforcing a specific appropriate behavior, like saying, "Can I have?" while withholding reinforcement for screaming? A. Differential reinforcement of other behavior. DRO. B. Differential reinforcement of incompatible behavior. DRI. C. Differential reinforcement of alternative behavior. DRA. D. Differential reinforcement of low rates. DRL. Answer. C. Differential reinforcement of alternative behavior. DRA. This question asks you to identify a specific differential reinforcement procedure used to replace a problem behavior with a specific, more appropriate one. Differential reinforcement of alternative behavior, DRA, involves reinforcing a specific behavior that is an alternative to the challenging behavior, saying, "Can I have?" while simultaneously withholding reinforcement for the challenging behavior, screaming. DRA reinforces any other behavior. DRI reinforces a behavior physically impossible to do at the same time. DRL reinforces a lower rate. DRI is about teaching a specific better behavior instead of the challenging one. Question 29. When should an RBT document session information? A. Only if something significant happened during the session. B. At the end of the week for all sessions. C. At the end of each session, as soon as possible after providing services. D. Only when requested by the supervisor. Answer: C. At the end of each session, as soon as possible after providing services. This question is about timely documentation. Session notes and data must be documented accurately and promptly after the session is completed. This ensures the information is fresh in your mind and provides the supervisor with up-to-date data for clinical decision-making. Waiting until the end of the week, B, or only documenting significant events, A, leads to incomplete or inaccurate records. Documentation is a routine requirement, not just done when asked. D, get your notes done right after the session ends. Question 30. What is the primary role of the supervising BCBA/BCABA regarding the RBT's clinical work? A. To manage client billing and authorization. B. To provide administrative support like scheduling. C. To provide clinical oversight, supervision, and decision-making for client programs and behaviors. D. To train the RBT on general ABA principles, but not client-specific plans. Answer: C. To provide clinical oversight, supervision, and decision-making for client programs and behaviors. This question highlights the main responsibility of your supervisor. The BCBA or BCABA is responsible for everything clinical related to the clients you work with. This includes designing treatment plans, providing ongoing supervision, analyzing data, making clinical decisions, and ensuring the quality and ethical nature of the services provided by the RBT. Administrative tasks, B, are not their primary role. They train you on client-specific plans, not just general principles. D, your supervisor is the one making the clinical calls and guiding your work. Question 31. Which measurement method is best suited for behaviors that occur at a very high rate or are continuous throughout the session, making it impractical to count every instance? A. Frequency. B. Duration. C. Interval recording example partial interval. D. Latency. Answer: C. Interval recording example partial interval. This question asks you to select a measurement method for a behavior that is hard to track continuously. For behaviors that happen constantly, very quickly, or many times per minute, using interval recording, like partial interval or whole interval, is often a more practical way to get an estimate of the behavior's occurrence than trying to count every single time. Frequency, or time the total duration precisely. Latency measures time to start. When counting or timing every instance is too hard because the behavior happens so much, use interval recording. Question 32. What is the ethical responsibility of the RBT if they are directed by a parent to implement a procedure that contradicts the client's written behavior plan? A. Implement the parent's request immediately. B. Explain that you must follow the supervisor's plan and suggest the parent discuss the request with the BCBA. C. Implement the procedure but document that the parent requested it. D. Stop the session and leave immediately. Answer: B. Explain that you must follow the supervisor's plan and suggest the parent discuss the request with the BCBA. This question addresses a crucial ethical conflict between a parent request and the supervisor's plan. Your ethical duty is to follow the behavior intervention plan designed and supervised by your BCBA/BCABA. You are not authorized to modify the plan based on parent requests. You must politely explain that you follow the plan as written by your supervisor and direct the parent to communicate their request or suggestion to the supervisor. Implementing the request, a C, violates your ethical code and scope of practice. Leaving, D, is inappropriate. Your supervisor makes the decisions about the plan. Question 33. You are conducting a preference assessment using a multiple stimulus without replacement. MSWO procedure. After the client selects an item, what happens to that item for the rest of the assessment trials? A. It is immediately given to the client as reinforcement. B. It is returned to the array for the next choice. C. It is removed from the array for the rest of the assessment. D. It is partially consumed and then returned to the array. Answer: C. It is removed from the array for the rest of the assessment. This question asks about the specific procedure for an MS-DOA preference assessment. The without replacement part is key. In this method, multiple items are presented. When the client chooses an item, they get brief access to it, but then that chosen item is removed from the selection set for all subsequent trials within that assessment. This forces choices among the remaining items, creating a preference hierarchy. With replacement, MSW would return the item B. Removing the chosen item is what makes it without replacement. Question 34. What is the primary ethical consideration when selecting target behaviors for intervention? A. Whether the behavior is easy to measure and track. B. Whether the behavior is socially significant and will lead to meaningful improvements in the client's life. C. Whether the behavior is typically targeted for clients with this diagnosis. D. Whether the behavior can be changed quickly to show rapid progress. Answer: B. Whether the behavior is socially significant and will lead to meaningful improvements in the client's life. This question emphasizes the ethical principle of choosing relevant goals in ABA. Socially significant behaviors are those that are important to the individual client and their community, leading to positive changes in their independence, social interactions, safety, or overall quality of life. ABA focuses on changing behaviors that truly matter, while other factors, a CD, might be considered. The ethical priority is selecting goals that are socially significant and will benefit the client's life. Question 35. When is it appropriate for an RBT to physically intervene in a client's challenging behavior? A. Whenever the behavior is non-compliant. B. As a consequence for any instance of aggression. C. Only when trained to do so, and only when necessary to prevent immediate serious harm, as specified in the client's crisis plan. D. When other behavior reduction strategies have failed for the session. Answer: C. Only when trained to do so, and only when necessary to prevent immediate serious harm, as specified in the client's crisis plan. This question addresses the very serious and restrictive procedure of physical intervention. Physical intervention should only ever be used as a last resort for safety, specifically when there is an immediate risk of serious harm to the client or others that cannot be prevented otherwise. Crucially, RBTs must only use physical interventions if they have been specifically trained in the approved procedures for that client, as outlined in their individualized crisis plan and under supervisor direction. It is not used for non-compliance, A, as a general consequence, B, or just because other things didn't work in the moment. D, physical intervention is a safety measure for immediate serious danger used only as trained.